Hello, I'm Dr. Chad Faulkner, and I practice in Mount Sterling and Winchester, Kentucky at Faulkner Family Chiropractic. I'm trusted to treat families, police officers, and athletes in our community, and probably many of your friends. In the next few minutes, I'll share with you the exciting method that I have used to help so many that struggle with pain and loss of mobility. People of all ages. Did you know that back pain is the number one reasons why people visit the doctor? Not heart disease, not coughs or flus, but back pain. Today I'll be revealing the primary method I've used to help thousands of people restore their motion and get out of pain, all without drugs and medications. Have you found that activities such as lawn work, household activities, and the sports activities that you're involved in mean you have to pay the price to do it? If you're like many who are frustrated at the aches and pains of old injuries, or you may feel like you're just getting old, what I'm about to share with you could literally change your life for the better. Hi, and I'm Dr. Chad Faulkner. Many of my friends call me Dr. Chad, and I'm the founder and developer of the Faulkner fascial method of chiropractic technique. This technique cares for patients who suffer from pain and loss of mobility to the back, neck, arms, shoulders, feet, knees, you name it. The great thing about the technique is it addresses the body's self-healing capacity to recruit growth factors and healing that decrease future injuries, decrease pain, and increase mobility. What's the history of the development of it? Well, traditional chiropractic, as it relates to the majority of practicing profession, is based upon the science, art, philosophy, and manipulation of the spine. Chiropractors call this the chiropractic adjustment. The examination may include feeling the vertebrae to determine if they are out of alignment. I, Dr. Chad Faulkner, has influenced early in the career to the effects of injuries when I tore both of my medial collateral ligaments, knees, skiing in 2003. And as a result of my injury, I began to develop tendinitis that I was afraid would lead to arthritis. And so addressing body and spinal tension is traditional methods did not work for me. This is why I developed the Faulkner fascial method of chiropractic technique. In most forms of chiropractic, physical therapy, and medicine, this area has really largely been ignored because it can be used literally anywhere where there's skin on an injury. In medical areas of dermatology and surgery specialties, collagen tissue is an important factor in the healing process. These physicians have a vast knowledge of pathology in the healing process because they work with it. They work with the tissue every day, and the tissue is called fascia. And I have observed that most of my patients present with musculoskeletal pain are chronic in nature and have this tissue that has developed in the fascia. And the breaking point for patients is when their parameters no longer respond to the same methods, such as prescribed, such as over-the-counter pain relievers. Heat, ice, stretching aren't working. And now synergistic muscles are proliferated with this scar tissue. In layman's terms, the pain may have started in your low back and now it goes down the leg. And the patient will more than likely begin to modify activities such as getting in and out of a car or changing methods of doing dishes or laundry. And most traumas to the body result in damage to the fascia and then develop tension in the spine resulting in pain and further stress wearing down of the frame that eventually develops diseases such as tendinitis and arthritis. The tool used in the diagnosis of underlying tissue changes is called the diagnostic ultrasound. The ultrasound produces sound waves which are then interpreted onto a digital screen. Many health problems improve with Faulkner fascial method of chiropractic using the diagnostic ultrasound. The technique starts by analyzing which tissues are overworked, tight, or weak. The patient may get the following for treatment of scar tissue: chiropractic adjustment, which includes the high velocity, low impact, often known as the POP; chiropractic mobilization, which is slow, sustained movement to push the body into the right movement pattern; and class 4 laser is focused light directed to the tissue and the spine. And last, the ART, the gold standard of scar tissue release. Typical treatments last about 5 to 8 minutes where focus is using the hands, pressing in on the tension, and taking those tight tissues out of dysfunction. The stress is released similar to jumping on a trampoline. At first, the tension is going to be tight, but as the damaged area responds, the tissue becomes lighter to the touch. At times, we may need to do dry needling, similar to acupuncture. But there's mounds of evidence to decrease pain with these stubborn cases. Are you healing? If you are living well, you have no symptoms. You're sleeping well, you have vibrant energy. If it's you're dying, you'll develop symptoms of a body that's in a state of stress, pain, loss of mobility, difficulty concentrating, and loss of energy. It's as simple as that. We have 2 convenient locations to serve you, Mount Sterling and Winchester. Give our friendly staff a call at 859-762-0009.